today's world, there are several challenges healthcare providers are facing when it comes to revenue cycle management, such as accuracy, timelines, compliance, and coordination. The whole process is very critical and needs a certain accuracy in order to avoid any mistakes that can cause time loss. Meanwhile, the hospitals have to be timely and enhance their patient experience. They also have to keep in mind how to reduce manual data entry and errors, which will cause more costs if it's not handled properly. They also have to keep in mind protecting patient privacy, prevent fraud, and follow regulations. Today we're going to have George Akil with us from Kodak Alaris, who is the business development manager, and we're going to talk to him about the solutions that we implemented on one of the biggest hospitals in India.
Good morning, Seda.
Hi George, how are you today?
I'm good.
You look very sharp.
Thank you. I tried my best.
You look very good.
So why are we here?
So the reason we are here, the reason we dragged you here is because we wanted to talk about our process claiming procedure and the revenue cycle management. So we have a very excited project in India on the healthcare, and we wanted to talk to you about this. So could you explain us what's happening?
Sure, thank you, Seda. So let me just introduce myself. As you mentioned, my name is George, and I'm responsible for the digital solutions in Kodak Alaris for what is called the Meta cluster, which includes by default India as a subcluster or as a region. In general, my role is practically to support the digital pivot that is being driven in Kodak Alaris to focus more on end customer challenges and to help them adopt a better approach to the digital transformation. As we all know, we offer all the digital transformation tools and we excel in that area, and it's about time that we introduce to the market our new portfolio of digital transformation software solutions and help our end customer in today's challenges and as well in the future. And this specific use case or this specific sector that we'll be talking about today is very important for us because we have seen it during the last pandemic. This is a very critical and vital sector for all communities in all countries. So we tend to approach this sector in a very serious manner and in a very detailed manner. So from a detailed part, we tend to approach it to listen to them, to accept their challenges, to understand what do they do on a day-to-day and across all of their divisions and departments, and then to come back and offer and create a new value proposition to them. And this is actually what we'll be talking about, I think, in today's questions and answers.
Exactly. This is exactly what we're going to focus on.
Thank you.
So George, can you elaborate on the revenue cycle management process and its correlation with the claim
processing? Yes, thank you, Seda, for the question. To understand revenue cycle management, I need first of all to look at the full ecosystem of hospitals and the revenue stream. So mainly, per definition, revenue cycle management is the process that ensures healthcare providers gets paid and covers the full process from onboarding the patient to diagnostics, to making sure he received the correct health service, medication, and then processing the claim to whoever is going to pay for the healthcare provider for that specific cost. So to understand this and how critical it is, we need to understand the operation of a hospital or of a healthcare provider. So how do they operate and what do they do? So mainly a hospital usually takes care and provides healthcare for people who are sick or in terms of emergency or what we call outpatient, the ones who visit the clinics just for consultancy and get medication. So practically they have high cost of operations for nurses, for doctors, for a lot of things in terms of facilities. They have a lot of revenue to cover. Where does this revenue is coming from? This revenue comes from usually government funds, supporting entities, insurances, or cash patients that would cover from their own pocket. If we need to segregate this revenue in terms of what is the biggest revenue for a hospital, it's mainly from government funds or from insurance. So practically a hospital or a healthcare provider, they provide the service, they spend the cost, and then they wait for their revenue to cover that cost. And practically for a healthcare provider, it is extremely critical to be able to continue offering that service in the market or for patients to continue and to keep a healthy revenue cycle management process. In general, how critical it is an RCM to a healthcare provider is very critical. If it stops, it means there is no more of healthcare services provided to patients. And this is what we are seeing so far. For example, European countries where this process is not governed properly, and so the risk of stopping healthcare services for the patients is something tangible. So if we look at it, in terms of claims processing, the hospital will provide the healthcare service, it will provide their services and everything, and then it will collect all these documents and pass them to, again, either government fund or insurance, so that they can pay them back for the amount that the insurance it covers. If we examine the revenue cycle management process in terms of steps, it goes through from onboarding the patient, getting the initial approval, which means I get the patient name, I check all their background, I check if they have insurance coverage, and then I get the initial approval from the insurance. And this is something very important, because the initial approval of the insurance or of the government fund, whoever is sponsoring that healthcare service, does not mean that they will be paid. It means that they got just an initial approval. And then once everything is done for that patient, they collect all the supporting documents and they have to submit them to these insurances or to these funds so that they get the second approval and they get their payments. So this is where claims processing from a healthcare provider comes to play a huge and major role in the revenue cycle management.
Mm-hmm. And if you're looking to, again, a healthcare provider, what are the possible challenges and obstacles that one can face? And how are we as Kodak Alaris addressing those problems and solving them?
Okay. What happens during a revenue cycle management process? So practically you have to get the information and the data of the patient. You have to check whoever is covering for their services. And then you have to submit every single document so that the fund or the sponsor or the insurance gets to approve on that payment and gets to pay us back as hospitals or as clinics, regardless of the nature of the healthcare provider. So in that term, the challenges are diverse. They can be from technical and they can be from business. From technical, you'll have all the related component of whether the information is collected correctly, accurately, on time, are all the documents supporting information being submitted to the insurance. All of these are major challenges that are facing all healthcare providers in the revenue cycle management process and as well claims processing segment of that process in specific. But as well, all of these challenges, they have actually a business impact. Now, what is the business impact? As we were mentioning before, in terms of revenue cycle management, the biggest major impact on this and the challenge is to delay the revenue for the hospital. Delaying the revenue of the hospital, it is purely a financial challenge that can be translated into different KPIs. So the claim to be paid, it is called in terms of financial terminology, like accounts payable or open accounts for them. So usually a hospital will, for example, collect several insurances depending on how they deal with it. For a single insurance, several claims, and they raise an invoice towards that insurance so that they pay them. So in case I have anything that is pending on any level of a claim, this will mean there is a delay in the approval of that specific invoice. Mm-hmm. This means a delay in the revenue. So aging invoices, delay in revenue, you'll have even denials. Some claims will be denied, and this is something to be addressed. You'll have patient experience, you'll have patient coverage, and you'll have, of course, rotation and the overall service quality of the hospital. Mm-hmm. So these are the challenges. Now, in terms of how we can help, as you know, in Kodak Alaris, we are an imaging company. We are specialized in digitization and digital transformation. So the first thing, if we look at it, we try to impact and to address all the technical challenges. So there are a lot of our technology that can help in terms of addressing and dealing with the technical challenges from, for example, the first of all, while they onboard the patient, we can make sure that the data is collected more automatically and more accurately. The second would be sure that these documents that are being submitted to the insurance are correct. So for example, and mainly insurances, they go in terms of a very generic and standard process. So all of them, they need the main concept of documents. In case of any exception, they would come back to the hospital and ask for something. So to make sure that all branches of a hospital or the clinics or everyone are submitting the correct number of documents, this will impact dramatically by reducing the number of denied claims or by reducing the number of exceptions that an insurance would raise back to the hospital and say, please, let's address this or provide us more. So in terms of data capturing, we can do this. In terms of digitizing, we can do this. In terms of document classification, this is where we can help. In terms of automation, to make sure what kind of documents have been submitted correctly, do we need something more? All of this will be processed before these documents goes to being submitted to the insurance. More business rules automation can be done from our side, and more futuristic approach can be delivered by Kodak Alaris. Take a certain KPI of our approach towards revenue cycle management and claims processing, we can reduce up to 80% of the hassle and challenges that are facing these healthcare providers in terms of collecting the data, making sure it is correct, validating every single data point and submitting it to the insurance companies.
Yes, you talk about the perfect flow, how an ideal flow should look like, but if we again look at the healthcare provider, what would be the possible challenges that they face, and how are we again implementing our solutions and addressing those problems?
So in terms of challenges, first of all, a healthcare provider might have several branches, correct? So I might, for the use case that we are talking about here, it is based in one of the largest geographies that we have in our cluster. So they would have several branches, and every branch will be managed in a different way. But the first challenge would be in terms of infrastructure. Are all the branches and all the places that these claims or these documents are being collected, they have the same infrastructure? The second one would be process streamlining. So I need all my branches to be mainly following the same process steps and following the same technology tool. And for that to be done, you'll have whatever solution you'll be implementing to be centralized in terms of management and in terms of monitoring. A second challenge would be human error, whether on manual data entry or on validation or on several things. This needs to be changed. A third or fourth challenge, another challenge that they would be facing, are the continuous changes that are coming from government entities, insurances, or regulation and compliance bodies. And this will translate in the ever-changing business rules and process limitation that they need to comply with. For example, if an insurance today says to submit a certain claim and for me to approve it, you need to, for example, submit 4 supporting document types. That's perfectly fine. Tomorrow, with a certain regulation, new regulation, the insurance might have to request additional 3 document types. And this is something that the solution always needs to address and be extremely flexible to answer this. So all of these challenges, not to take all which is the legacy challenges in terms of handling the paper, not losing any piece of content, making sure the digitization is happening on a timely manner, very accurately. All of these things which are the legacy things, which right now they are being, let's say, guaranteed part of our solution. What we want to provide is beyond these challenges, and even taking anyone who's adopting our revenue cycle management solution for the next 5 years. Because right now, these are common challenges. Tomorrow, we'll find more challenges which are adopting to the new technologies of, for example, AI technologies or better patient experience, or having chatbots or AI engine acting as the first diagnostic tool for these patients. So all of these things we can answer with our technology. So we are looking for today's challenges, but also for the future.
Okay, so we are providing them in a way future-proof solutions.
Yes.
Great. Okay. So can you tell us about this case study that you were involved in India? It's one of the biggest hospitals, and as far as I know, they have lots of branches and they have a huge volume on the patient.
Yeah.
So how was your involvement there, and what was the specific problem, and what was the Kodak Alaris solution that we offered them?
Thank you. Okay, that would be very interesting for our listeners to get to know. So practically this hospital, and this part, it's gonna be very, let's say, number centric, because it's very important to get to know these information. Again, for revenue cycle management, everything is related to cash flow. So it is protecting the cash flow, making sure the revenue is coming at the correct time to sustain the healthcare provider operations. So in general, this hospital, and it's very important because it will get a sense of the scalability of how big our solution can go. In terms of number, they have more than 11,000 doctors, 10,000 beds, more than 73 hospitals across the geography of India, 90 primary care clinics, an overall of $1.9 billion of annual revenue achieved or recognized in 2022. So this is an overall view of the hospital. Their main challenge in revenue cycle management, we are talking about 73 hospitals. So plus or minus process streamlining, that was a big thing for them. Second of all, making sure that these documents are submitted at the correct time with the correct accuracy, with the correct information. That was another big challenge for them. And talking about the technical challenges, another thing for them was to make sure all the validation is being done before submitting the claims to the insurance provider, to the funds that needs to sponsor this cost for them. Most important, they had a lot of error in terms of whether manual data entry or validation, and as well they had a lot of aging in terms of accounts receivable, which is by nature the cause of all these delays or these challenges. Whenever you submit something wrong to anyone that, for example, you want money from them, the first thing they will tell you, are you sure I owe you this amount? So practically they will ask for some documentation, but for the sake of the healthcare, mainly this process is very streamlined. So practically the business rules that this hospital needs to comply with are practically can be all automated. So these were the challenges that we needed to face, and our solution, luckily, is practically answering all these pain points. So plus or minus, we have a centralized management solution that run on any of end user device. So whether it's a tablet or a laptop or a desktop, it doesn't matter, or even a smart hardware part of Kodak Alaris portfolio, which is called Infuse. They can have that solution over there to collect that information, to digitize it, and then pass it to the central server for more data processing. Now, if we want to go a little bit deeper in terms of data processing, what do we do over there? First of all, we make sure that the data is accurately being extracted from all the documents. That's number one. Second, we do what we call data enrichment. So anything that we need to add to that file, digital file right now, so it is physical on the level of the branch, on the level of the central server, it becomes all digital. If we need to add anything more in terms of digital files to make sure that that record is fully supported with all the evidence for the payment to be concluded, we can connect to several channels by integration, even to email boxes, integration to healthcare system, to make sure that that record is fully complete and is ready to being submitted. The next thing that we do is classification and validation. We make sure that all the records are being submitted as requested by the insurance company, providing all the data that is needed. And over here, there is something very interesting that we did for that specific healthcare entity, is that they had, on some level, the data is connected to 2 or 3 systems, and on other streams for claims that to be submitted, and for other, let's say, segments of patients, that data was not fully integrated. So over here, the platform that we offered, first of all, by nature, the ability to integrate and to fetch more data from other systems, to enrich the information and the data that the insurance will look at. But as well, in case that integration is not there, we're relying on our advanced data extraction, whether from OCR or even form parsing based on AI and machine learning, to extract all this specific data from within the papers of these documents. So if the data is not, we are not capable to extract it by integration, we're capable to extract it from the document itself. And by that, we went and offered them the possibility to have a final step of verification, validation, manual, which is based again on automated business rules. So for example, they will be able to get the summation of all the claims that they are submitting to a certain insurance, compare it to the invoice that they are raising towards that insurance, and to have some sort of validation, automated, but as well a certain step for someone to approve and to submit that record towards the insurance or whoever sponsor will cover that cost of healthcare that's been provided. Now, talking about the solution, it has been, first of all, implemented in a record time. Practically, the testing happened over 2 to 3 months. In that specific place, our partner in India played a huge role with our team in the regional office to provide more or less a consultative approach. So that was the turnkey for the healthcare provider, for that hospital in India, to gain trust with our people. We didn't go and approach them as normal sales. We sat down, we listened to their challenges. Again, their infrastructure provided 2 different challenges that needs to be answered at the same time. We had a certain call to adopt a consultative approach with them, to listen to their challenges and to offer them the most accurate architecture of our solution that would answer their challenge.
And what excites them when we talk about our solution? What was the most excitement item for them that they're like, yes, we're sold, let's go with it?
Perfect question. So plus or minus, there's three pillars to that answer. First of all, the unique selling point of our technology. So to be able to integrate, to be able to call out for advanced machine learning and AI engine, to be able to offer the flexibility to be installed on a scanner, or to be installed on a mobile device, or to be installed or to be accessed through a web browser. All of these kind of flexibility and scalability was just amazing for them. Keep in mind, in terms of technical architecture, we can dig deeper in terms of how data can be synced through different servers, but for the sake of keeping things simple, we will mention that we offer advanced features and technical functionality for our solution, which, let's say, it was surprising for them and reassured them on this level. From another level, there is the short-term gains that they were excited about. So this, during testing, they were able to explore that they could actually reach certain KPIs and enhancement in terms of productivity, but for the overall financial process. And something that we can recall as well, that the buy-in came first from the IT or from the people of the technology, that they saw the potential of the technology or of the platform that we are offering. The second buy-in came not from the hospital operation, but from the hospital finance director, because they saw the direct impact on their revenue cycle and how they can directly outperform their current situation in terms of collection, in terms of cash flow, and in terms of protecting their operation from a financial perspective. So these KPI, once they saw that they can actually achieve them while we were doing the testing environment, that was the second thing that excited them. The third thing that the customer is long-term plan that we put with them. The long-term plan over here, I'm talking about scalability, to be able to scale and streamline that process across the 90 clinics and 73 hospitals. So that was something very crucial for them. If they can have all their network running on the same technology with the same process, then everything would be fine. They can exponentially grow their benefits. The second thing is the technology components that we can bring to them to make sure that this process will always be more and more leveraged and more productive in the future. There is practically no limitation for them to adopt future technology on the same platform.
If we want to do a future adjustment within the system, how easy it is to apply in the system?
In terms of technicality, it is, let's say, I could say it is as easy as pushing a button. But again, our approach is not purely technical or purely sales. Our approach is understanding the business use case, the business challenge, and then not only connecting to future technology, but recommending future technology to be connected to our platform. Mainly from technical side, we are very open to connect and very easy to connect to any technology component coming today, tomorrow, or in the farther future. But the most important thing is to bring value to the customer. So if it's really beneficial for them, from technical side, they have no worry or concern to address. But from business side, this is where our expert with our partners and our channels, or from our team, is the role that we play, and we bring that value to our customers. So do you really need it? And if you need it, in which context and where to position it? And the correct positioning plays a huge role in terms of the technology performance, but as well to reach to the business goals. And talking about the business goals, I would again go to numbers and mention that in specific for this specific use case, they were able to reduce their denial of claims by 64%. So let's say they were submitting 10,000 claims per month and they were receiving 1,000 denial, which is exception handling. They were able to reduce that to a matter of 360 denials only, which means higher invoicing and better cash flow. They were able to reduce 38% in their aging invoices, which means an invoice that is submitted to an insurance, it is aging. Why? Because there is an exception that we need to handle. And why this exception is happening? Because part of the supporting document or the information is not complete there yet. So that's another thing that they were able to achieve. 45 plus in terms of NPS indicator for their patient satisfaction survey, and 81% of first call resolution rate on whatever claims are pending. So practically in the RCM process, whenever you have an exception, you either call the insurance to resolve the problem, or call your patient to resolve the problem, or call the doctor to resolve the problem. Now, if we were able to reduce it by 81%, then what was the factor? The factor is the data. If the data is there, plus or minus, the problem is very visible. So you just need to have one call with one question to resolve the exception and to pass everything to the insurance and to resolve the payment. 4% improved collection of pending cash. So not for the overall, of only pending cash, which means from the age invoices or whatever claims they have submitted and it's still pending for a reason or two, they were able to increase the collection of these pending invoices by 4%, which is something very important for a hospital. That tiny amount might make it or break it for their operation. Other KPIs that you will be able to see, or whoever our audience is watching us will be able to see in our detailed use case or in the brochure, but for the time being, I think we have said enough.
Yes, and there is also, we are talking about very concrete results and reduce on costs and everything, but there's also the hidden costs that we cannot see at the first. So if you talk about the time that we're putting into the employees' time, these are all hidden costs in a way, and this is also impacting the effectiveness of the cost employees working and the time that is put in, so affecting that, right?
That's a very correct question and very on point, because this is again why we have built trust with this hospital. If we want to talk about our colleagues in the market, not to call them competitors, and they approach legacy practice to approach this kind of solution and challenges, mainly the ROI is being calculated on the amount of time we are saving the end user. So how much time I'm saving them, and then we'll be able to conclude on the time and cost that this hospital will be saving towards the investment that they are doing with our technology. This will yield to a clear ROI with our technology. If we follow the same path, this will yield to a clear ROI within 12 to 18 months. The worst case scenario would be 24 months. And this is a common practice that we, let's say, go with, and we used to go with in the past. Right now, once we answer the main core business challenge, we would like to address the ROI from a different perspective, from the core challenge of the hospital. So once we say, for example, 4% increase of cash flow on pending invoices, we stop calculating the amount of time. We go to the bigger value, because the amount of time being saved, it's transactional. It is very, let's say, once you calculate the other benefits, it becomes a very tiny portion of the overall benefit that they are getting, even on the real amount of revenue to investment. So practically, when we say 4% increase of pending cash flow from 4% of increased collection from pending cash, that's actually can be something around $100,000 or $200,000. When we say 38% reduced aging report or reduced aging on invoices to be collected, that's actually another, practically when we talk about 90 clinics and 73 hospitals, that would be in terms of millions of dollars. So if they take out a tiny proportion of that achieved revenue from this, they will achieve their ROI in the first month or 2 months. So from this perspective, yes, there is a hidden cost, but from our side, we do not tap into it. That's a legacy approach to it. We can, of course, calculate the ROI on that level, but the most important is to discuss the revenue that we are saving, protecting that operation. If we just call it as an investment or an insurance to protect your cash flow, then we are much more profitable for the healthcare sector.
Sounds great. Thank you so much, George.
Thank you, Seda.